Tennis elbow actually comes in 3 injury stages, and it's a little bit strange for me that people don't discuss this more often, because one of the most common reasons we see why people's tennis elbow is not getting better or it may be getting worse is that they use the wrong type of treatment for the stage their injury is in. Now, in this video, I am going to explain what tennis elbow feels like, the typical symptoms, as well as demonstrate some tests. But then I'm also going to help you understand what the stages of the injury is so that you can make better choices about your treatment. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment of any type of sports injury, all done via video call. Have a look at the description of this video if you want a link to our website. So tennis elbow develops in the tendons that attaches your outer forearm muscles to your outer elbow. So it's the ones that you can see when you tense your muscles like that. My forearms are not that big though. These muscles, their main job is to bring your wrist up. They do help a little bit with turning or turning it in and out depending on the action, but the main action is that lifting up action. So if you want to picture this, you've got the tendons on this side attaching to the fingers and to the wrist. Then you have the muscle bellies, and then the muscle bellies come into separate tendons that come together and they attach around this area. Now, if you speak to a lot of people who's got tennis elbow, you'll very quickly understand that there are many different activities that can actually cause tennis elbow, and very few of them are linked to tennis. It's anything that uses the action of pulling the wrist up or keeping it in that position while you load it. And the common thing with these activities is that it's usually overload or overworking those muscles in those activities that then leads to tennis elbow. Now, if we look at what actually happens on a cellular level that causes this injury, if you think of exercise as well as activity, because physical activity is kind of exercise, it's just got a different goal to it. So anything that uses the body causes micro injuries in the tissues that you use. Now, this is absolutely normal. And what happens is when you get these little micro injuries, it signals to the brain that it needs to come and repair them and make that tissue stronger because you want to be able to load it. And it's through that repair cycle that you eventually grow stronger. Now, what happens is if you do more than what your body has been prepared for, because it's only got a certain amount of strength or capacity to cope with work and activity at that moment in time, and it depends on what you've done in the months before. So if you do too much compared to what you've been doing, then you can actually cause injuries that's not micro, but a proper overuse injury. Or if you don't allow it recovery time after you've done an activity, the body doesn't have time to repair it. And then the micro injuries accumulate and you end up with overuse injuries like a tendonitis or tendinopathy. So if we think of the typical activities that can cause tennis elbow, obviously in the gym, anything where you're gripping, because the gripping action actually uses these muscles really tightly, as well as the front muscles. So anything gripping, pushing, anything where you're going to do this type of action. So that's why the backhand in tennis is the most common one. In normal daily activities, it's using the mouse, because can you see that position that you rest your wrist in? It's small, but you're constantly doing that and you're constantly keeping it there. So if you do this for hours and hours on end, you're just tiring them out and they eventually get to the point where they're so tired. Or typically, something else that can happen is you use the mouse the whole day long. You don't actually know that, oh, my arms feel tight, but it's not that bad. And then you go to the gym. But now your muscles are already tired, so then they overload. Also, things like spring cleaning in the garden. So suddenly using lots of tools that involves cutting or even that scissors action, or typically painting the house because it's that action. So any of those activities that actually uses the arms can cause tennis elbow. I remember one patient, she had an amazing lot of strawberries from the garden and she spent hours just taking the green bits off to make jam, and that caused her tennis elbow. None of these activities is a problem per se. It's when you overdo them or overuse them and don't mix things up that they then can cause an overuse injury. So I mentioned at the start that tennis elbow comes in 3 stages, and we really want to have a rough idea of what stage your tendon is in so that we can choose the best treatments for it. Now, these stages aren't like clear cut that this one starts here, that one stops here. They do overlap a little bit, but you just need a rough idea. And regardless of the stage your injury is in, you can recover. All it means is that you need to use slightly different treatments depending on the stage you're in, as well as sometimes your injury will take a bit longer to recover if you're in a different stage. Now, also, you don't have to do scans necessarily to understand what stage you're in. The length of time you've had your symptoms for and how your symptoms are reacting to things can tell us a lot about what stage it is in. So let's look at that. If you look at a healthy tendon under a microscope, it's made up of lots and lots of collagen fibers that's packed into parallel. And it's this parallel structure that gives it its strength. So I don't know if you did that experiment at school where you had one piece of string, could easily break it, but then you put about 5 or 6 together and you try to break it and it's really, really strong. So the collagen fibers being packed in that way is the key to the strength of the tendon. The first stage of a tendonitis or tendinopathy is called a reactive tendinopathy. And at this point, it's when you've had your symptoms just for a few days or a couple of weeks maybe. And if you look at the tendon under a microscope, the tendon structure is still there and it's still strong. All that you see is that there's a bit of fluid that accumulated between the fibers, so it's a bit swollen, and there are some different types of cells moving into the area, some inflammatory cells, but it's not a massive inflammatory reaction, and researchers at this point think that, yes, a bit of inflammation is involved, but it's likely to try and actually help the injury recover, and inflammation or excessive inflammation is not part of the injury process here. So the key thing to understand in the reactive tendinopathy phase is, although your tendon is very painful and uncomfortable at this point, it's actually very strong because that tendon still has its good structure there. So if you've been picturing loads of micro tears in your tendon and been worried that you're going to tear something, get that picture out of your mind. There aren't any micro tears in there. It's just the fibers are irritated in that part of the tendon and a little bit swollen with fluid between them. And also, importantly, it's not the whole tendon that looks like that. It's usually only a portion of the tendon that's affected. So that's also important for the other stages to think about. The good news is, although a tendon that's in the reactive stage of tendinopathy can be really painful and really uncomfortable, it's actually, if you apply the correct treatments at this stage, your recovery time is the quickest of all of the stages. And the reason for this is we've not seen any structural damage yet. So the structure of the tendon is intact. It's not lost strength. It's just super sensitive and irritated. So the best treatments at this point is anything that can help calm that tendon down. So we're talking about relative rest, reducing activities so that the tendon can calm down. Load management, thinking about how often you use this arm, can you use the other arm to do things, and anything else that can just help it to settle. Now, I've made a very detailed video about the treatments that work in the different stages. And if you're interested in the details of the treatment, have a look at the description of this video. I'll put a link to that other one in there. The worst thing you can do is add strength training exercises or strong stretches or anything at this point, because this tendon is overworked. That's how the injury happened. If you now add strength training exercises on top of that, you're just going to make it worse in the reactive stage. And also, it's not lost its structure of the tendon. It's not lost its strength yet. It's just irritated. So exercise has less of a function during this stage than in the other stages. Now, tendons can be fickle things, and it can be really hard to rest your elbow properly. So what we often see is that people don't get the opportunity to rest their arms, or they just don't understand that they have to rest it, or they apply the wrong treatments, like they jump in with strength training in the reactive phase, and then actually the injury progresses and it goes into the disrepair phase. Now, if you've had your pain for more than a couple of months, or your symptoms, then your tendon may have entered the disrepair phase. And at this point, if you looked at the tendon under scans, you can see that it's lost a bit of its parallel structure in that area, so the fibers aren't quite that aligned. And also you've got little blood vessels and nerves growing into that part of the tendon. And remember, it's not the whole tendon that's affected, it's only a small area of the tendon. The rest of the tendon is still healthy and strong. if you start with the correct treatments in the disrepair phase, it will take longer to recover than the reactive phase. But the question that everybody always wants to understand is it possible for that tendon to regain its normal structure? And yes, there is evidence that if you apply the correct treatments in the disrepair stage, you can actually get the tendon to look like a normal tendon again. And the best treatments during this stage is a mixture of load management again, so figuring out what the capacity of the tendon is at the moment that it will handle so that you don't overload it in your rehab as well as your daily life, plus some gentle strength training exercises, or I say gentle, it's got to start gentle and then it's got to ramp up to restore the strength of the tendon and get that part of the tendon to rebuild in its normal way. And basically that's what strength training exercises does, is it stimulates that area of the body to go through that micro-injury repair cycle so that it can grow stronger and healthy in that area again. But like I said, I've made a whole video that goes into detail about all of these treatments, so have a look at the description of this one if you want a link to that. The third stage of a tendinopathy is called the degenerative phase, and if you've had your pain for several months or perhaps even longer than a year, your tendon may have entered the degenerative phase. Now remember, it's only a small portion of the tendon that's affected. The rest is still healthy and strong. If you look under scans, what you'll see is that that portion of the tendon that's affected now has lost the parallel structure of the fibers. So it's not as strong as it used to be. It's lost its strength. And you can also still see more blood vessels and little nerves growing into that area. Now at this point, you can still regain your full pain-free function. So what that means is being able to do all your activities without pain and discomfort. But that area of the tendon that's affected will likely not regain its normal structure. And at this point, what happens with treatment is we look at strengthening the rest of the tendon so that it supports that injured part, that the injured part doesn't get overloaded. Because remember, the injured part has lost its strength, but we can get the rest of the tendon stronger, and then it doesn't really matter because it's only a small part of the tendon that's affected. So the best treatments in this time is, again, remembering load management. So you bring that activities to a point that the elbow can cope with, but then adding in strength training exercises and really slowly building strength over time. Just a quick note on the different names you can find for tennis elbow. So I think we can all agree that tennis elbow is not the best name for this condition because very few people actually get tennis elbow from playing tennis. One of the names you may hear is lateral epicondylitis. Now that is the medical name that was previously used and previously advised, but any medical name that ends in itis means that inflammation plays a major role in what's caused it. And I think we can agree now that we've seen what happens on scans, there isn't a massive inflammatory process going on, so researchers feel that that is actually not the best name for it. These days, they prefer to call it a tendinopathy, which indicates that there's a degenerative phase to something and not a massive inflammatory phase. So the name they prefer these days is lateral elbow tendinopathy. I'm going to stick with tennis elbow because it's the term that says the easiest and it means the same thing. But just know that if you have a diagnosis of tennis elbow, lateral epicondylitis, or lateral elbow tendinopathy, it all refers to the same thing. I also just quickly want to touch on what pain tells you about your injury, because the pain people feel when they have tennis elbow can vary a lot. Some people just have a little bit of discomfort when they carry really heavy things, while others can have a super painful elbow, and even the slightest thing can really flare the pain up. Now, research has shown that there's no link between severity of injury and the amount of pain you feel. So some people can have lots and lots of pain, and when they look at the tendon, it's actually quite strong and there's not much going on in there. And that's typically for the reactive phase actually as well, that the pain in the reactive phase can usually be the worst, but it's got the least damage to it. But then there's people who have very little pain and they're in the degenerative phase, and actually there's quite a lot of tendon changes going on there. So pain is not something that you can trust to tell you how bad your injury is. But also, pain is not a good guide for, oh, I've got this much pain, therefore it means I'm in this stage of tendinopathy, because even that changes over time. Why is this? What's happening here? Well, so far research has found that there's several things that can amplify pain or make it feel worse than what the actual injury is. And it's usually stuff to do with things that can increase your stress hormones, because when you have pain, the same hormones get the brain to create pain as the hormones that gets released when you stress. So the more of those hormones you have in your blood, the more pain the body is creating, or the brain is creating, because it reckons that's what needs to happen. So anything that affects your sleep, poor sleep, work stress, stress in social life, anxiety about things, being really worried about the impact of this elbow on your income or your finances, for instance, if you can't work. All of those things can amplify the level of pain you feel. Also, there's good evidence that if you've had an injury for longer than 3 months, then the body actually becomes better at creating pain. It's kind of as if it wants to say to you, "Hoi, mate, can you please take some action here? Why are you ignoring the injury?" So what you get when they look at that area is you have more of the receptors that sends the signals to the brain that gets interpreted as pain. Those receptors fire more easily for less and less activity. So where before you had to hit your hand with a hammer to get a pain signal to the brain, now all you have to do is touch it gently, and that can create a pain signal to the brain. And I think we can agree that hitting it with a hammer, yep, that does damage, but actually touching it gently like that doesn't do damage, it just triggers the pain. And the reason I'm on about this is it's important to understand that for your rehab, because especially when people have had pain for a long time, they're worried about doing anything that causes any type of sensation or discomfort in that area, because they think they're making their injury worse. And that is usually not the case. And when I talk about the treatments, I'll help you understand that it's usually absolutely fine to feel some discomfort while you're doing things, but you don't really want anything that massively increases your pain over time, or especially in the 24 hours after that. So there's always it's okay and you can expect it to feel a little bit uncomfortable, but it shouldn't actually make you think, "Oh, that is a lot more uncomfortable now," after you've done something. But more on that in the treatment video. Before we dive into treatments, it's also important to make sure that you actually have tennis elbow, because if you have a different condition that feels similar, the treatments may also not work. So we're going to look at a few different things to diagnose this. The first thing that physios usually look at is at what do your symptoms feel like, where do you get them, and how do they react to different things, because that tells us whether we can suspect this condition of being the right one. And then we're going to do some tests to test the muscle specifically. So the symptoms you feel with tennis elbow can be pain or stiffness, or both of them together. And you feel it mostly over this area of the elbow, the outer area or the lateral area. And the main pain is usually close to the bone there, but it can be along the tendons there as well. And then if you've had your pain for quite a long time, it can come into the front of the forearm and a little bit up into the upper arm as well. Now, if you have tingling or funny sensations or numbness, that's usually a sign that the nerve is irritated as well. And that really needs to get checked. Now, if you've had long-term tennis elbow, yes, absolutely, that can irritate your nerve as well, because there's a nerve that runs really close there. But it might also be there's certain conditions of the neck that can actually cause referred pain that can feel like tennis elbow, but it's not tennis elbow. And also on that note, if you are getting a really stiff neck or shoulder pain itself, then it's worth getting it checked by a physiotherapist, because it may be that actually you've got an injury to those areas that's causing this pain. Or it can simply be that actually you have tennis elbow, but it's also affecting, because the nerve gets irritated and stuff, it's affecting the rest of it. And you may need exercises and activities to address these areas as well. Another important thing to look at when you think about diagnosing tennis elbow is how the symptoms started. Now, typically, the symptoms for tennis elbow build slowly over time. So it can be that you did an activity, felt absolutely fine, and then several hours later you thought, now it's starting to feel uncomfortable, and it progresses from there. Or perhaps the next morning you wake up and you think, "Oh, what have I done to my elbow?" Or even while you're doing it, over several days, like for instance, if you're typing, you could feel it progressively getting more and more stiff and tight and uncomfortable. If your pain started with a sharp, sudden pain while you were doing an activity, then it might not be tennis elbow. It may actually be that you've torn something in there or injured the joint, and you have to get it checked to just check that your diagnosis is correct. The final clue here is what activities actually causes you pain. With tennis elbow, it's got to be something that uses the wrist extensor muscles. So an activity that requires gripping or pushing or pulling or this action. If it's mainly with elbow movements that you get the pain, then it may actually be your elbow joint or something else that's injured in there, and it's really worth getting that checked. But remember, with a lot of elbow movements, you actually have to grip as well. So it could be that it's a combination of the two, but it has to be that you're using this part. Now, you can get, depending on how irritated your tendon is, you may feel strong pain or you may feel only slight discomfort. You may also find that sometimes there's a delayed reaction, so it doesn't feel too bad while you're doing the activity, but then several hours later it really flares up and feels uncomfortable. That's a typical sign of a tendinopathy if it has the delayed pain response after an activity. The final step in diagnosing tennis elbow is to do some physical tests to actually load the muscles and the tendon that's injured to see if it can make it hurt. Now, there are 3 tests that's typically used, and they are not 100% accurate or 100% sensitive to diagnosing this. So, and depending on the part of the tendon that's irritated, you may have pain in some of them and not in others. So you will likely not have pain in all 3 these tests, but as long as you have pain in one of them, plus the history of how the injury started, plus how your symptoms react to everything else we've just spoken about, fits with tennis elbow, then you may likely have tennis elbow. So the first test is called Cozen's test. And what we do here is we're going to get a forceful contraction of the wrist extensor muscles, which does that action, to see if I contract them really strongly, does it cause pain? So the action we're doing is elbow straight out. You bend your wrist up into that position, but not as high as you can, just about 2/3 of the way. And then you want to bring the wrist in to this side a little bit. So the wrist is bent up, and now I'm just turning it slightly there. It won't have a lot of movement. It's just an ever so slight movement towards the thumb side. And then you use your other hand to try and reverse that movement into that direction. So I'm pushing against it, and I'm having to really push against myself to not get it to go. Now, a positive test that might mean that you've got tennis elbow is if you do that movement, that resisted movement, and it causes pain in this area. Next, we've got Mills' test, which does the opposite. Instead of contracting the muscles against resistance, this test is testing what happens if you stretch the tissue. Can that bring on pain? So you have the arm out in front of you and palm facing down, and you bring the wrist down and you just increase that stretch. Now, I am hypermobile in my wrist, so don't worry if your wrist can't go back that far. That's just how far mine goes. And it's seen as a positive test if you get discomfort over the outer elbow again. Now, in practice, I find if my patient doesn't get pain like that, if I get them to make a fist first and then take it down, I can often elicit the pain there. So, and also, if you've got a hypermobile patient like I am, this test is often not that sensitive because my tissues and tendons move so far that I don't actually get to a point where I properly stretch them. This test for myself, I found, is more sensitive in people who are on the stiffer side of the spectrum. Then finally, we've got Maudsley's test, which tests specifically for the extensor digitorum muscle. And all you do is wrist out straight again, and we're going to press down on the middle finger and resist it that it doesn't move. So just a little bit of wrist extension like that, press down onto your middle finger and hold it against resistance. And if you get any pain in this area, that's seen as a positive test. At this point, you're probably thinking, but what about scans? Can we not just scan the thing? Of course you can. And yes, ultrasound scans and MRI scans can be quite useful. MRI scan is probably overkill for this injury. Ultrasound scan is absolutely enough to figure out that it is the correct diagnosis. But you don't need scans for it. It's usually enough to take a thorough history and understand what the symptoms feel like, how they react, plus doing these tests can usually give you a pretty accurate diagnosis. I would say it's only if your injury is not reacting as you expect it to react to treatment that I would then perhaps go and see if a scan can be useful to just help us understand the diagnosis better. Or if you're getting symptoms that don't really fit with tennis elbow diagnosis, then a scan might also be useful. Brilliant. Hope you found that useful. Now remember, if you need more help with an injury, you're welcome to consult one of the team via video call. The link to the website is in the description of this video. Take care.